After this intro, I would like to present a case that has been referred to my clinic. Young female, 27 years, which have injected with filler into the nasolabial area of her left side at 4 April 11 p.m. During the injection, there was no pain, but the doctor noticed changing in the color of the skin above the upper lip and starting to give her more than 1,500 units of hyaluronic enzyme and reassure the patient. And after 1 hour later, the patient noticed changing in color of her skin, like bleaching spots separated to the left side of her nose and numbness. After half hour at the time of 12:45, numbness sensation converted to pain. The patient starting to contact her physician and tell him that she's starting to feel pain and the upper lip and her nose. And the doctor advised her to use warm pack and to inject dexamethasone ampule. The patient didn't take the prescribed injection. At 4, the patient wakes with very unnoticed the color still changing into pinkish to redness around the bleaching sites. 5th of April at 9, the patient starts to fear fainting, and after several hours at 1 p.m. she went to the physician, and the physician gave her a Aspirin dexamethasone injection and inject her for the second time with hyaluronidase. You may ask the question that why the patient didn't get benefits from first 1,500 units of the hyaluronidase at the first time. The reason behind that is the site and depth of the injection was incorrect, because the injection was at the same place of injecting the fillers, which was in the first. Here we should know that when you give the antidote, you should give it in the correct way. I mean, by that, you should know the anatomy of the artery that supply above the injection site, and the embolism will stop according to its size when the artery getting smaller and will cause ischemic changes accordingly. And when you give the antidote, you should flood the areas that being affected and also in different depths. At 5 p.m. hot pads, the color starting to get in bluish associated with swelling and pain. 6th of April, the physician contacts me and told me what procedure he was taking to the young lady. And I asked for the latest photo of her. Here I asked the doctor to send the patient to my clinic, and I stated to examine her nerve endings around the necrotic tissues. At that time, it was being more than 36 hours past. I took the following action at once, and I used more than 2,500 units of antidote and diluted with Xylocaine, 2%, which also have vasodilated as a dilator effect of the arteries and reduce the pain, and stating to inject into the way of the facial artery above the injection site and in different layers. As we said before, that the antidote enzyme have the capability of crossing the walls of arteries, so you may or not inject into the main artery. Eventually it will take its effect.